What I'd like to see is that patients have access to understand what a surgery will cost before they decide to have it at a hospital. Hey everyone, it's Dr. Potter. You'll remember that a couple of weeks ago, I posted about transparency in healthcare, the transparency and coverage rule, and that applies to insurers, and the hospital price transparency rule. So the government enacted these rules, and it's so great that we have them, except the hospitals and the insurers really aren't complying in the spirit of the law. President Trump's administration enacted some rules that really were meant to increase price transparency on the hospital side and on the insurance side. But the hospitals and insurance companies really didn't live up to their responsibilities. They have shirked their duties and not reported the information that we have needed and that the president requested. Just this past week, he signed another order saying, I see what you did, insurance companies and hospitals, and I'm back and I'm going to put some teeth behind the enforcement of this policy. I'm actually encouraged by it. I'm also just really encouraged that the wording of this specific order focuses on the patient, on the individual patient. Previously, we had heard about these machine-readable files that were published, and that was really for data analysis. That's not really something that a patient can use in real time when they're deciding where to get their health care, where they're going to go for a surgery or go to the emergency room or to have a baby. It's certainly not something that doctors can analyze to see if their patients are getting the best deal on their care. But what this administration has said in this executive order is we want to give specific information to patients to have it in their hands at the time when they are making those decisions. So I'm really excited to see how they manage to do that. And this is something that I have wanted for my patients for a long time. What I'd like to see is that patients have access to understand what a surgery will cost before they decide to have it at a hospital. I think that this is going to have a lot of trickle-down effects. And as a physician, I can look at that information and decide, gosh, do I want to be privileged at hospital A or hospital B? Where do I want to take my business and my patients' surgeries? Do I want to go to a hospital that's paying appropriately for that surgery or that's overcharging for that surgery? I'm really excited to see how transparency increases competition in multiple ways. I'm here for it. Thanks.